talk about not all lubricants are created equal, and I know this is something that we've talked about before. So if someone is experiencing painful intercourse, what would you recommend?
So, I mean, first and foremost, seeing your gynecologist. Why? To rule out that you have an infection, that there's something that needs treated with an antibiotic, that, the lubricants are mostly used for vaginal dryness predominantly, or just needing more lubrication for intercourse. So number one is just making sure that there's not a reason for painful intercourse, like an ovarian cyst or a yeast infection or something that needs further treated. Once we know that's not the case, then there are multiple products that can be used for lubricants. They're broken down into categories, basically by ingredients. So there's water-based lubricants and a whole list of those. These are all over-the-counter products.
Okay.
There's silicone-based lubricants, which are personally my favorite because they last a little bit longer and are smoother for patients. Those are also something that are over-the-counter, not always at your local pharmacy, so something that you'd be more likely to have to go and purchase on the internet, but does not require a prescription. And then there's other medications that we use for the symptoms if it's vaginal dryness, the things we've talked about previously in the menopause talk, which may involve prescription therapies for dryness to help with pain. So, the water-based, the silicone-based, occasionally oil-based lubricants are also around. And then some over-the-counter products we previously mentioned in the menopause talk, which are coconut oil and olive oil, actually.
That's
Your local
news to
grocery
me.
store, it can be a little bit messy, but are safe to use vaginally, and so also something that you could try, before going to that particular aisle, or something you may have in your home to begin with.
Okay.